Hi, Tony.
Hello.
I'm Dr. Train. I'm so glad that you're here to come and see me today. And it's an honor for me to have you as my patient. I've seen that your wife referred you to me. I'm thankful that she did. Yeah, I want to render you the same care I did for her so you can go for your friends and family back to us or to a chiropractor in the area to get treatment on their body, make sure it's working right. And took a look at your paper, see that you have a few areas of concern you want me to target. I'm thankful that you filled out the paper to its entirety, all the information I need. But before we address those areas, let me tell you a little bit about how chiropractic works. In your information, I can see that you're a computer engineer. So the body, I'm going to relate back to that. The body is like a computer unit. There's the brain, spinal cord, and the nerves, which is like the CPU for a computer. It controls everything. So it's like the brain to the body, and all the nerves, it's like the wire that runs from the CPU to control the monitor, keyboard, the mouse, and all the counterparts of a computer. So for me to treat you or find out what's wrong with you, I'll have to detect what's called vertebral subluxation, or interference in your vertebra, which, as you can see a model here, bone is all lined up. There's a subluxation, bone will be out of place, which causes interference to the nerve and cause that to not work. Same way with the computer, if there's the interference in the wire, one of the counterparts won't work, like the screen on the keyboard. So subluxation can happen to anybody. It can happen early in your childhood. Like with kids, they can jump off the couch or fall off a tree. Little incidents like that can cause a subluxation. Even like the birthing process, it can cause a subluxation. And usually for kids, the subluxation is asymptomatic, which means that they don't feel no pain or anything. They'll usually cry for about 1 or 2 minutes, but after that, they'll be back to normal. But then muscle will spasm up or whatnot and causes decrease in motion in the joint. That way it'll decrease the function of their body. And if those subluxation left there uncorrected for 10, 20, 30 years, it can cause degeneration or breakdown, like the disc or the nerve cause it to break down and not work anymore. So when that happens, you can feel like achy pains or not, numbness, tingling, muscle spasms. You can see swelling and it's kind of hot to touch or whatnot. So from the head to your hip, there's 26 movable parts that we can affect to take out that interference. And the nerves from the neck, it controls the head, neck, shoulder, arms, and hands. It also controls the eyes, ears, and throat. And anywhere from the mid-back controls the mid-back, all the muscles there, all the chest cavity and abdomen, and all the organs inside it, like heart and lungs. And from the low back, it controls all the muscle from there down. And it also controls your genitalia, bowels and bladder, legs, and feet. So when we treat these subluxation or little interference, we'll use specific techniques and whatnot to put the bone back in place to take that interference off the nerves. And usually, most patients that comes in and we treat, they always complain about pain. Well, once we get treated with that, usually the pain will subside and go away. It might not work on the first treatment, but you have to come back for multiple treatment to decrease that pain overall. Most patients that we see also reported that there were other things that improved after we treated them, like their vision, their heart blood pressure drop, and stuff like that. So it's more than just pain that we address. Okay, so before we can treat you, we'll have to do a complete thorough exam over you, like orthopedic exam, neurological exam, and chiropractic exam to find out what's wrong. So after I do that, I'll look at all your information, I'll review it and write up a report for you tomorrow when you come back. We can devise up a treatment plan or whatnot so we can treat you. So is there any questions or anything that you have?
No, no.
If none, then we can go ahead and start your treatment plan.
Okay.